On the Health Watch today, stroke victims in rural Wisconsin will soon have the same healing resources as patients living in the city.
And it's all thanks to the internet. It's a program called Telestroke, which connects rural hospitals with specialists in larger facilities. And to tell us all about it is DJ Curran, the telehealth program manager for SSM Healthcare of Wisconsin. And thanks so much for being here. How does this exactly work? It's pretty cool stuff.
It is. Basically what happens is that when a patient presents at a rural hospital and they're having any of the classic stroke symptoms, right now the provider would have to contact and probably med flight that individual into one of the larger facilities here in Madison. With Telestroke, they can literally wheel in a cart and have a video conference, which is similar to how you would use video chat online, but much higher quality and fully secure. And a specialist, neurologist, can do the diagnosing right over that video session with help of a nurse there in the emergency room and be able to identify, yes, this is a stroke, or no, this isn't, provide treatment right over the video, and the individual never even has to leave that facility. It's quite amazing.
This is being used in other parts of the country.
It is, absolutely.
It works pretty well.
It does. There's hundreds of hospitals that are already using this. There's even a few here in Wisconsin that are using it, but it is something that very quickly is going to be coming to our area of Wisconsin and southwest Wisconsin.
You hear a lot about minutes and if not seconds mattering when it
Absolutely.
comes to stroke.
Stroke, their favorite is time is brain time. So
kidding.
Every minute missed is a minute that they would want to be able to provide that care. There's a couple of drugs that have just a few hours that can have almost full recovery versus having, a lifetime of medical treatment necessary.
And if you have to put somebody in a helicopter to Madison, that's
Absolutely.
make a huge difference.
Absolutely.
And I assume this saves quite a bit of money too.
It does. There's definitely some cost savings involved when you don't have to med flight and you don't have to provide that, but beyond that, it also is very helpful for those rural facilities that probably don't have a neurologist available or somebody certified in stroke. They can get those high-level specialist care out in those rural areas. They don't have to have someone on staff or have to call someone locally.
And one of the things we were listening here are the digital images. It's amazing to think, too, that those digital images can be that clear, that the neurologist at one of the facilities like at St. Mary's in Madison or in Janesville, they can see that.
Absolutely. And we've been doing this actually in our area for quite a while. We have individuals that are taking the images at, say, Edgerton Hospital, and they're being read at St. Mary's Hospital, and the clarity of it is absolutely the same as if they were standing right there.
And this is going to go statewide eventually.
It will. You'll actually see this go all the way across the nation, without a question. And it's just a matter of making sure that the areas have enough internet bandwidth so they can take those quality video images and make sure that the care is going to be the same.
Now, is this also something being used for training some of the people in the rural hospitals too? I imagine that they can help learn, it can help teach them what some of those symptoms are too, right?
Absolutely, and that's a big part of telehealth in general. There's one part that's the telemedicine, and the other one is also the education of clinicians. They're required to have a certain amount of education every year, and instead of having to travel to Madison and be out of clinic or out of hospital for that time, they can do it all through the internet on video conferences.
It's pretty amazing.
It is. It's great.
It's a whole new world.
It is.
Kidding.
It is. Using it to the best of the advantage, using those technologies is great.
All right. Well, thanks for filling this in with this. Has started rolling out gradually?
I would say you'll start seeing a lot more within the next 6 to 9 months. You'll be seeing a lot of it, not only for emergency care, but also for clinic care, allowing individuals to get, instead of having to travel into Madison to see a dermatologist, they can see them right there in their hometown.
DJ, thanks for being with us today.
No problem.
Appreciate it.
Thanks so much.